As I've developed as a therapist, and I've been a therapist for about 35 years, and I've been a Gestalt therapist for about 30 years, I focus much less on technique. In part, it's because it's there for me when I need it. I know technique. But and this was part of the criticism of Fritz Perls in the late 60s. If the therapy becomes about technique, then you lose the person.
Right.
So what's most important is what happens in the relationship.
Okay. Right.
That's really what's most important. So technique, for example, there's the kind of well-known technique of the empty chair.
Right.
So somebody is saying, well, there's a part of me that feels this way and a part of me that feels that way. I want to do this, but then I say this. I might say, okay, there's this part of you here, and there's that part of you there. Don't talk to the chair. Talk to the part of you that...
Right.
Okay. And then we can go back and forth and have a dialogue and see what emerges in terms of resolution, or perhaps some piece of your history emerges, or whatever it is. It's called an experiment because we don't know what's going to happen.
Right.
All we know is that there's something to explore and to heighten awareness about. So that may be a technique. Just pointing awareness to your breathing is a technique. Right? Or letting you know that when you said this, it really affected me. Right. If I say that as a technique, then I'm not really in the relationship.
Right.
But if I know...
You know it is, but it's something...
But it also has to be true.
Right. Right.
In the late 60s, when Fritz Perls would say to somebody, "You're full of shit," right?
Right.
I would say, yes, that's confrontational, and that's also... that can be very humiliating and shaming,
right.
And can destroy any sense of trust and safety.
Right.
Okay, and to the degree that that happened or ever happens, that's not in the service of anyone's therapy.
Okay.
However, I will say to people who I have a relationship with, who I've been working with, who tell me something, I might say, I think you're a little full of shit.
Right, right.
Okay, but that's different.
Right.
Okay. But
that's more calling awareness now.
That's right.
Okay.
That's right. Anytime I ask you what you notice in your immediate experience, that's a bit confrontational.
Okay. Yeah. Right.
Okay? Now the question is it a confrontation that feels like an attack?
Right.
In which case it's not useful. Or is it confrontation that engages you in some mutual interest and exploration and curiosity about your experience? The simple way to answer that is, again, to return to the late 60s and to say, well, yes, Gestalt therapy is not an episodic kind of showy approach that focuses on technique. Gestalt therapy is an approach which focuses very much on the subtleties of emerging experience within the context of relationship and with awareness of all of the various aspects of self, body, mind, emotions, and looks at the complexity of the interplay of all of those elements and sees the emerging self really as the development of all of those elements as they either are interrupted or not interrupted. Okay. Now that looks and feels and sounds very different than hit the pillow and scream at your mother.
Right.
So yes, the therapy has developed quite a bit. The principles of awareness, present-centeredness, wholeness, integration of aspects of self, those are all consistent throughout. But the way the way the work is done looks very different. The best way to get the experience is to have some experience in the work yourself. Now, that doesn't necessarily mean committing to a course of therapy. There are, for example, our institute periodically will offer introductory workshops. So, be a 2-hour event, people come, somebody from our faculty will talk a bit about the therapy, what it is, and then do kind of some experiments and some demonstration. So you get a taste of it. But yes, it's an experiential therapy. So you really can't understand it. That's right.